I'm Dr. Truesdale. I'm a double board certified facial plastic surgeon and I work in Beverly Hills, California. Forget what you know. I'm here to show you the real. What does it really like to be a plastic surgeon? What is it really like to take someone back in time? To make them look different, to make them look prettier, or just to give them a boost of confidence with a subtle enhancement. I perform anything in the face. I do it all. Hair surgery, facelifts, nose surgery, anything that you can think of to make a person's face or neck look different, that's my jam. I'm pulling back the curtain on my practice to show you the real people, the real procedures, and the real results. This is about real life journeys, inspiring transformations, and the power of feeling confident in your own skin. We'll explore everything from subtle enhancements to life-changing transformations. I'm gonna share my story, the stories of my patients who've entrusted me with their faces and their dreams. Almost no one knows how stressful my job is, but the moment when someone sees their new reflection, that's why I do this. Because changing someone's face can change their whole life. This is beyond the surface. Juanita is our beautiful patient. She's from New York City, and she was seen in the news because someone threw acid on her face, which is crazy. She reached out to me over a year ago now, actually on TikTok, saying, hey doctor, I would love for you to look at my case. And she was so sweet, I wanted to help her. And so at no cost, I said, listen, I will help you with your scars. So the first surgery was dealing with her nose, her lip, and her facial scar. And that was a very, very complicated surgery. She had a very thick keloid in her nose. It was causing the lip to be lifted up. The nostril was pretty much gone, and then a very thick keloid there. So it was affecting her breathing, affecting her face. But it was too much surgery to bite off at one time, reconstructing both the face and the neck keloid. So the first surgery, what I did is I basically did a reverse facelift, right? It's called a deep plane cervical facial advancement flap, where I took skin and muscle and actually brought them from this direction to rebuild her nose, her nostril, and give her a new smile, her lip back. Now, the other part of that though was that I was leaving behind this really big keloid underneath her chin. So it was too much surgery to bite off at one time, and I was worried about blood supply issues. So she's coming back today for revision, right? So I'm gonna take care of that second scar, surgery number 2. I've gotta put my thinking cap on because I don't actually know how I'm gonna do this. I know I'm going to, but it's gonna be tricky. I'm doing 3D gymnastics in my mind.
I can imagine.
Because the goal, I know the middle part was bothering you a lot, right?
Yeah, that little hole.
The little circle.
Mm-hmm.
I'm gonna try to close all of this, but I don't wanna close it and then it be too tight.
Definitely. Yeah, so I'm here today to do a surgery with Dr. Truesdale because I was unfortunately assaulted in New York, where I reside. I was working at Kings County Hospital in New York City, and as I was on my way to the hospital, working as a PCA coordinator, basically like just taking care of patients that come in and get out of surgery, I was on my way to work and some random lady just threw acid on me on my way there. And so as a result of that, I suffered 2nd and 3rd degree burns. And I went to my job, to the ER to, get recovery and stuff. And then they didn't have the proper tools there, so they transferred me to Jacoby. And then as I was there, I was in the burn ICU for about a week. And being there, they did a few different surgeries where they did debridements and removed the top layer of skin. And then they wanted me to just wait for over 6 months to a year until I do my next surgeries to see how it heals. But by that time, thankfully, I had just randomly DM'd Dr. Truesdale because he came on my For You page. He was already going viral and stuff. So I just DM'd him hey, if you have anything to let me know, that would be really great. So then we ended up doing a consultation and things just went, I just felt so comfortable with Dr. Truesdale. I just can't even explain how heard I felt and just things like that. And he genuinely catered to my worries and things that I wasn't even worried about and just things like that. So and then, then that's when we set up our surgery. He agreed to do it pro bono because he understood my circumstances, and I just genuinely am in awe and so appreciative for him.
The other option is me stealing some skin from this side. Okay. And using that as a skin graft if I think that it is too tight.
Well, we're gonna defer to you because, like you said, when you get in there, it's like a different ball.
Yeah.
I know you're gonna choose the best outcome possible, so we're 100% on board. Whatever you think.
Whatever you
Right. And when are you guys heading back?
Saturday night. Our flight is at 11.
At night.
So you'll be here tomorrow, and then I can see you tomorrow. So I do want to see you tomorrow.
Okay.
And then on Saturday. Okay. And you're gonna take the stitches out at home?
Yeah.
Okay. All right. Well, I don't know. I'm gonna see when I get
Yeah.
but I'm gonna do what I think is best. It's gonna be some
exactly.
combination of bringing the skin edges together.
Okay.
Right? Maybe if I don't have enough skin to work with, borrow some skin from the looseness in the neck. Right?
Mm-hmm.
Oh,
Which-
that's why you were saying.
That's why I was
so
saying.
So
And I
Yeah.
don't even imagine how like thin the line, because the line's gonna be like this.
Yeah,
There's no scar
right.
here.
That's
so
the
why
idea.
I think-
That's the idea.
Oh.
That's yeah.
That's the idea.
Occurred. My face originally was like tightened, so my lip was like all the way towards my nose, and then this was all together in one subunit. So it was like basically my cheek, nostril, and lip was all together right here. So he had separated it, thankfully, and so now I have my lip down here, like leveled out, and he gave me my nasal line back so that it could at least be like, you know, separated from my cheek. And I had a big scar of the like acid and keloided, and it had keloided, so he had removed all of that as well. And so as he removed that, then he took a piece of my shoulder and put it here as a graft so that it can not like pull it, and so it wouldn't be no complications in the future. And I haven't had any complications, thankfully. And like it was very helpful that he had did that too, because prior to that surgery I had a whole bunch of like nerve damage, and my skin was in so much pain at random times. And ever since the surgery, I haven't had any of those like nerve painful like sensations and stuff. So yeah. And then now we're just doing a scar revision where we're taking away this keloid and opening up the nose.
Now, every scar, it has its limitations in terms of what we can do, and it's usually a trade-off. We're trading one scar for another. She is an amazing young woman. She recently graduated from college, and she hasn't let her scars, facial or trauma otherwise, hold her back. So I'm really, really excited to be a part of her journey as she continues to find herself and basically reverse this trauma that she's had. So the way that I do plastic surgery is that every single face is different and gets a little bit of a different care. But there is always a sequence of steps that you kind of know you have to do if you're doing a facelift, if you're doing a chin implant, right? It's like you gotta put it in, you gotta move the things around. You might make little small nuances of where they go, or maybe treat the tissue a little bit differently. But in essence, cosmetic surgery, if you're doing it well, right, there's basic things that you have to do. When you are dealing with something reconstructive, there are no rules, right? There is no book. You have to put your thinking cap on because the anatomy is different and each scar is different. Where it is different. The person's healing is different. And so for Juanita in particular, when I've seen the scar before, you know, I was always a little bit intimidated because it's like, where am I going to get the skin to close this wound once I cut the keloid out? And if you cut something out, you need to put it back together. Now, we have what we call the reconstructive ladder in plastic surgery, right? Some people call it an escalator because you could, you know, go up different flights of stairs or different levels very quickly. But that's anything from just closing something directly. I couldn't do that for her. You know, basically, if you're just thinking about a very simple closure and just bringing it back together, there's not enough tissue there. Next levels are, you know, skin grafts, full thickness, split thickness, local regional flaps, local flaps, free flaps, all of these things, tissue expanders. There's so many different things that you can do to think about closing and having tissue to close a wound. In her case, I knew I was dealing with her facial scar, which I've already dealt with, and her facial tissues and artery was already compromised during her first surgery. So I need to borrow tissue from her neck to do this. To do that, I need to make sure that I can do that with a tension-free closure. So I don't end up creating a scar and then it widening and being just as unsightly as her original keloid. So I needed to kind of bring all of these things in the concept. I needed to make the scar a little bit more irregular, and I needed to hide it at the border of the mandible because that's where the shadow and the bridge between looking at the facial subunit and the neck subunit are. I needed to bring all these little special things into play. Rebuilding the nostril, opening it up. You have to take into account the contracture of the scar. You have to take into account kind of maintaining the nice curvature of the ala and how much that looks similar to the other side. So all of these things, right, take a little bit of nuance, but I was up for the challenge. I'm very excited about her case and to put my reconstructive hat back on.
Hey, Dr. Truesdale, thank you so much for doing my surgeries. I am so beyond happy with my results. I am just like I'm so much more confident. I have so much more like positive energy and things like that. I have so much more motivation to complete the tasks that I have before me. You've definitely improved my just overall quality of life. Truly, I'm very thankful. My chin is just better than what I have ever expected my chin to look like when I was sitting in the ICU bed during this attack. I have this line. This is from when he removed my entire keloid, and I'm so thankful for that because my keloid was completely up here and it was so thick. And in every picture you could see it, in everything you could see it, and I was not a fan of that. So him removing that was amazing, and even the surgeries he did prior, where he removed the whole keloid out on my face, I don't know what's schooling, but geez Louise, I'm so thankful, beyond thankful. Words cannot explain how much I truly appreciate you giving me this opportunity to, just feel like myself again, because, that is very important. I never, prioritized how important I felt prior to this assault, but, you truly are giving people the opportunities to just, feel like themselves and feel natural and, just feel pretty.
Season 2 is coming to an end. You've seen rhinoplasties, you've seen facelifts, beautiful before and afters. You've seen me do my mom. You've seen couples, you've seen sisters, you've seen everything, but you haven't. Season 3 is coming soon and we're gonna get bigger, we're gonna get grander, and it's gonna be more amazing stories.